you have to be passionate about education, and I love it. And I love working with new to practice nurses.
35 in a cohort. That's a lot.
Listen, I was no short of doing a dance in front of the classroom at some point to keep to keep things interesting. And I'm not shy about that, because I will definitely do that. You're never alone. We always need to understand that we're going to reach out to one another when there's a need. But I think the important part with new to practice nurses is making sure that they're comfortable doing that they know what their resources are, how they can reach out if a question or an issue comes up.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by ONS member Christina Klein, Education Coordinator at Temple University Hospital in Philadelphia, Pennsylvania, and member of the Bucks Montgomery County's ONS chapter, to discuss orientation with new nurse graduates as they begin their careers in clinical settings and educational resources to help them build on their existing knowledge. You can also earn free NCPD contact hours by completing the evaluation we've linked in the episode notes. Thank you for joining us today, Christina.
Hi, Stephanie. Thanks for having me. It's a pleasure to be here.
So I can remember when I started in oncology, and I was lucky enough to have had kind of a externship during nursing school that I got to work on an oncology unit. So for me, I feel like it was a little bit easier getting in at that time to oncology, because a lot of oncology units were not accepting new grads on their units because they wanted them to have, some experience already. So for me, I felt like I was a lucky one. So, fast forward to where we are today and the shortage of nurses, around the country in different areas, and also just, how things have changed and, how we educate new nurses coming into oncology. Let's talk a little bit about what that new nurse orientation looks like and how you build those skills that the new nurses need to have to work on oncology units. Let's talk about that a little bit.
Absolutely. First, I have to agree with you completely. And part of the issue with having new nurses come into oncology is the curriculum itself. We need to, I think, expand a little bit in the nursing school curriculum to talk a little bit more about oncology. And part of the reason we're seeing nurses come in as new to practice in specialty areas is because that's what they want. Not only in oncology, but areas traditionally that we didn't have new to practice nurses coming in to, like the emergency department, labor and delivery, even into the operating room where we didn't traditionally see new to practice nurses come in. So the orientation process is definitely key. Our new to practice nurses come in with a great foundational knowledge. They made it through nursing school. They passed their NCLEX. So obviously they've got some skills when they come in, and they're able to provide safe patient care. But what we do in the new to practice program or orientation is build on those skills. We need to help these nurses develop critical thinking. And a big part of the orientation process is going through things like prioritization, delegation. And when we build on those skills, critical thinking is definitely expanded upon. And then the new to practice nurses become that competent bedside nurse. And that's what they want. When we talk to new to practice nurses, they talk all the time about time management. In the beginning, they see themselves running kind of back and forth on the unit, trying to get their bearings. Orientation is so important just to get to know the flow of the unit, the systems thinking around the hospital. In addition to that, We need to make sure that we address anything specific to the unit, any kind of hands-on skills. And all of this comes into conjunction with orientation, and then we expand upon it with the new to practice program so that we meet the objectives. And the main objective is to make sure that our nurses are competent at the bedside and providing quality patient care.
That's great. I think that probably most hospitals have that type of a setup where it's like you mentioned, learning time management skills. But let's now kind of move forward to oncology itself. What are some of the standard topics that would be included in a new to practice nurse's orientation that is specific to oncology or the cancer care continuum?
Yeah, I'm glad you asked the question because the care of an oncology patient can be very different than the other patients that we care for. When I started out as a new to practice nurse, I did quite a few years, a few decades of nursing before I shifted into an oncology setting. And I myself felt like I was a novice nurse. The treatment, the drugs are very different. So when we are talking about orientation specifically, we need to first talk about what cancer is. Then we dive into, diagnosis and screening. And these are very different steps with an oncology patient. When we think about it, if a patient comes in with another type of illness or chronic illness, for them, they'll have surgery, drug therapy, and follow-up care with the provider, go home and be okay. The oncology patient, that's not the case. Even if it's a lower stage disease, the patient is completely impacted by just getting the diagnosis of, hey, you have cancer. So as we approach these patients, it can be very different. So I know for me, when I came into the oncology setting, I needed to make sure that I first understood things like, cancer cell biology. I needed to get familiar with the drugs. I needed to become familiar with safe administration of the drugs. I needed to know about even things like survivorship and follow-up care with the cancer patient. I also needed to familiarize myself with every point of care that cancer patient was going to see. Everything from the nurse navigator to surgery, radiation oncology, because as I approach that patient, it's that overarching, holistic approach to care because everything in that patient is affected. And I need to be cognizant of that because I'm getting deeper into the assessment of the patient. And traditionally, oncology patients don't tend to be super open with nurses. A lot of times they have more fear of a treatment regimen stopping as opposed to toxicities. So we need to have really great assessment skills to hone in on that. And the nurse actually knowing what's going on with the patient prior to actually even interviewing or meeting the patient is key. And I think that's a little bit different for your traditional patient that you may see in an inpatient or outpatient setting. I need to know what's going on ahead of time so that I can pose the correct question. So I think there's a lot more critical thinking that we need to hone in on. And that's basically the difference. And those standard topics that we need to expand upon, again, are being able to coordinate also with all those multiple disciplines, not just the area in which you're working or the unit in which you're working.
Thinking about those new to practice nurses coming in and they just finished school, like you said, and test their NCLEX. But man, they thought they had a lot to learn in school. And then they come to an oncology unit and all of the new therapies that we have just being thrown at us constantly, as well as everything that you were saying in the new, their diagnosis, learning to work with multidisciplinary teams is such an important piece of this puzzle too, for these, new to practice nurses coming in. You did mention unit specific. So let's talk about that. What kinds of things are specific or different in oncology units?
So, depending on the unit in which a nurse is working, for example, at Temple Hospital, I have nurses that I oversee in the outpatient cancer center, in the infusion suite, radiation oncology, and the inpatient setting. So obviously, in the inpatient setting and on a med surge unit, it's not just the oncology piece, it's all the other med surge issues on top of that. So nurses have to be able to be familiarized with the different types of devices that cancer patients come in with. Things like ports, implanted ports, other types of long-term vascular access devices. And we need to make sure that our inpatient nurses, even our outpatient nurses, are very good with handling those devices for infection control reasons and other types of devices. Just the other day, I had to help our inpatient nurses in the oncology unit with a Plerex catheter for a patient that is managing end of life disease at home. And this is a palliative type of care. And it was very different. You know, we don't usually see these things in an inpatient unit. It's something that a patient comes in, the physician will see the patient in interventional radiology, and the patient's lung or abdomen will be tapped, and they'll come back to the unit and feel fine. But after we do that so many times, it's kind of an interesting concept that we're sending the patient home with that, and nurses need to be able to teach. So teaching is a very big part of it. That's across all of the units, but really what's specific to devices. If a nurse is working in an outpatient infusion suite, that nurse needs to be very comfortable with the different types of infusion therapy, chemotherapy, biotherapy, immunotherapy. And then we get into safe handling practices, making sure that our USP 800 is being followed. And also, again, teaching, being very specific with teaching the patient when they go home if they have any types of side effect and side effect management. A nurse who's working in the clinic as maybe a nurse navigator, those skills, we really need to hone in on being able to do a good assessment over the phone, because patients are coming into the office, but the follow-up care is via phone or some form of telemedicine. So we need to make sure that nurses are able to ask open-ended questions or ask the right questions to get the right information. If I have a nurse that's working in a stem cell unit or transplant unit, induction, consolidation, maintenance chemotherapy, and the toxicities are different. You know, the labs that we're seeing are very different. So we need to get specific there. Nurses working in radiation oncology, different set of side effects depending on where we're irradiating, and also to radiation safety. And it goes on from there. So with orientation, that specific unit, we're definitely going to have an overarching discussion on curriculum on basic oncology, oncologic emergencies. But if I have a radiation oncology nurse, there's going to be curriculum surrounded by the radiation oncology course, a hemonc course for my nurse working in transplant. And everybody needs, to talk about oncologic emergencies. It really does become unit specific. And a big part of it also, too, that I think that we always forget is to make sure that we hone in on asking the nurses what they need. For me, I have a big background in outpatient infusion, but I'm not a radiation oncology nurse. So it's really important to speak to that group of nurses, if it's not my specialty, to find out exactly what their needs are.
Thank you. That was a really great explanation and showed all the different areas that even within oncology, there's so much variety and how that would work. What are the differences between orientation approaches for the staff nurse type of position and the advanced practice nurses?
Very different. And we have to remember that our staff nurses, both are following the nursing process, both are assessing patients and providing care. Our staff nurse is basically following a provider's orders, whereas an advanced practice nurse may be responsible for giving those orders. They're responsible for diagnosis and screening of the patient and ordering those types of screening. So it's very different. Our APNs have to have more curriculum surrounding advanced assessment, advanced pharmacology, and when I work with an advanced practice provider, whereas the staff nurse works very closely with me as an education coordinator, their preceptor on the unit, nurse manager, the APN, I'm more of a facilitator. I'm giving them a bunch of resources and they will access the resources more independently. The other thing I do with an advanced practice provider is kind of coordinate things and making sure that they're working closely with the provider that they'll be working with, and also coordinating with other types of providers. If they're working with a medical oncologist, I'm going to make sure that relationship's going well. But I also want to make sure that they spend time with other providers, maybe the surgical oncologist, the radiation oncologist, things like the provider from the pain management team, palliative care and hospice. That's really important, and even interventional radiology. So I'll try to facilitate the APN spending time with those different providers so that, again, there's a good overarching relationship and networking for the APN as they reach out and maybe even tap into those other resources. And it's really important to help establish those relationships.
Okay, thank you. Now back to the new to practice nurse. What does the orientation process and timeline look like for both the new graduates and you as an education coordinator?
So for a new to practice nurse, timeline, it can vary. In general, it's 12 to 16 weeks for a new to practice nurse. When we're getting into specialty areas, it's going to be 16 weeks. So if it's a med surg unit, about 12 weeks, but getting into something like a specialty area like oncology, closer to 16 weeks. For me as an education coordinator, that's very variable. And the orientation process for an education coordinator, it's kind of lacking. There's not a lot of structure there. But again, education coordinators are generally nurses that have come in with experience and they can tell you what it is that they need. A new to practice nurse is definitely going to give feedback on what their needs are. And we always want to tap into that. But I know there are certain things that they need, regulatory requirements that I need to cover. And we have a whole list of things we go through. As an education coordinator, it's kind of like an ad hoc kind of thing. We sit down, have a conversation. We all get the same kind of systems orientation to the hospital and all the things that we need to tap into on a regular basis. And then from there, it's spending time with the preceptor, and the education coordinator would really kind of guide their own orientation and know when is enough time and when they have everything they need. And another thing is too, if you're working with a team, like I have a privilege of working with a really great team, for me, orientation is never done because we're always bouncing things off of one another. And that's really important to remember, even with new to practice nurses, off orientation experienced nurses, you're never alone. We always need to understand that we're going to reach out to one another when there's a need. But I think the important part with new to practice nurses is making sure that they're comfortable doing that they know what their resources are, how they can reach out if a question or an issue comes up.
Okay, well, you said somewhere between 12 and 16 weeks for that new to practice nurse orientation. If you were starting and beginning a new orientation program, let's say for a new specialty area within oncology, would it take you about that same amount of time to create their orientation program? Or how much time is it for you to actually create a orientation for a new program?
So creating a new orientation now, and I have to clarify, are we talking about something from scratch? Because one of the great things about working in education is usually you don't have to create something from scratch. That's where you tap into and find out, first of all, what's already been done. So if I had to create something from scratch, no, I don't think that it would take 12 to 16 weeks. I think that it would probably be more around that 4 to 6 week time frame. And again, it would depend if I'm starting from scratch or if there's something already in place and maybe I need to change things around, tweak things, update things a little bit.
I'm guessing that you take the feedback from each of your orientation classes and go back and look at that program that they just went through and see, where something might need tweaked, like you said. Or maybe there's something, a new product that is having to be used, or a new medical device that's having to be used in an area, and going back and adding that to the orientation that you're giving.
As far as evaluation, everything we do in education, there will never not be an evaluation form. We always look at that. We always ask a subset of standardized questions, and then there's always opportunity for, free text and give us feedback. And new to practice nurses, I have to tell you, are very good at giving feedback. If they really are not crazy about something, they let you know, and they will write things in. What I do when I'm working with new to practice nurses, I do one of two things. Immediately following an educational event or a presentation, if I have someone else come in and present, I immediately, after it's finished, get immediate feedback. And I ask them, I'm going to do this again for the next set of new to practice nurses. Is this worthy? And they'll tell me. But also there's that formalized evaluation form when we're done for the day. And we look at those, we go back and we make changes. Because as an education coordinator, there's nothing worse than giving information that's not valued. And you can sense it when you're giving these presentations or having these conversations. So I always go back and change things up. I'll reach out to other of my peers. I'll even directly ask other nurses. And I think it's really important to tap into former new to practice nurses. We do have them come back and say, hey, how could we change this? Because I tell my new to practice nurses all the time, I know we can always make this better, and we work together to make that happen. So that evaluation process is key.
Absolutely. I agree with you there. Now let's talk a little bit about resources. What have you created for those new to practice nurses coming into their new role?
So when I started as an education coordinator, I was at a cancer center. And part of the orientation process, you have your standardized orientation and things we need to cover. And what we realize is that any nurse coming in, new to practice or experienced nurse, really needs a good foundational knowledge of caring for the oncology patient. And that was the name of one of the courses I was responsible for creating, improving, updating, tweaking. And that was required by every nurse that was a new hire, every new to practice nurse. And what that course does is talks about what cancer is. It gets into anatomy and physiology. We get into things like the normal cell versus the malignant cell cycle, and how important that is. And we've all had that in nursing school, but it becomes so much more relative in the oncology setting, because when you're giving different types of drugs that are affecting different parts of the cell cycle, now it starts to really make sense. So we talk about that. We talk about things like metastasis. Then we get into all the different types of therapies that our cancer patient can have. And then integrative medicine, and then into things like screening. The course goes over even, again, survivorship. It's a very generalized course. What I had to do, because of timing issues, is also expand a little bit on the radiation oncology piece that was in there and the hematologic oncology piece in there, because it's really tough sometimes to make sure you cover all those points in different courses. So I kind of expanded that a little bit on those two topics, those two chapters. Oncologic emergencies is another course. And as a former critical care nurse, that was really an interest of mine. And that's kind of where I started. I was working as an outpatient infusion nurse, not having an advanced degree at that point, just having my undergraduate degree. And I got involved in helping to teach some of the chapters of oncologic emergencies. And as I was teaching part of that course, helping out other education coordinators before I was one, it didn't really flow really well. So when I became an education coordinator, I kind of revamped the whole thing. That course is talking about things that oncology nurses are going to see where other nurses may not see in their practice. They may not see DIC. They may not see spinal cord compression. And unless you work in critical care, you're not going to see increased intracranial pressure, but you're going to see that in the oncology setting for a patient that walks into the outpatient clinic and presents with symptoms. So oncologic emergencies was another course that every nurse had to go through. And in addition to that, if a nurse was going to work in the stem cell unit or transplant, it was the HEMONC course. If they were going to work in radiation oncology, it was a radiation oncology course. And other courses that were created, not so much for the new to practice, but once they're ready to do certification, was an oncology certification review course. So these are the courses that I was responsible for creating. But again, new to practice, we're required to go to Caring for the Oncology course, which was an in-person course, and pandemic hit, and then we kind of made it virtual, which worked really well. Obviously, in-person is so much better for nurse engagement. And oncologic emergencies, they were also required to attend that as well. If they wanted to go to the other courses, it wasn't their specialty area, they were more than welcome to go to, because I never turn away the ability to have additional education, but they would need to get their manager's approval.
As you were talking about that, I was thinking back to taking the OCN exam. And my specialty area that I worked in was bone marrow transplant. So for me, I felt super comfortable with the HEMONC and, that type of cancer patient. But the surgical things and the solid tumor or radiate, I understood radiation, fairly well, because we did have patients, who received radiation before transplant, but those weren't, my specialty areas. So in thinking about your role, are there barriers that professional development specialists need to overcome when they are developing these resources for, these new to practice nurses that might not be in your specialty area? What considerations would you take into account when you were doing something like that?
That's a great question. And I got to tell you right off the bat, you and I would make a great pair, because my specialty is in the solid tumor world. So I'm really comfortable with solid tumor, the surgical approaches, radiation oncology, not as much, but it definitely would see more patients in my practice in the solid tumor world, right? So what's really important is to be okay as an education coordinator that you don't know everything. And you need to reach out to other resources. Part of the barrier is being able to connect, especially now. I can't tell you how difficult it has become for me, especially with the pandemic, of trying to get other nurses, providers come into provide those pieces of curriculum that maybe are not my specialty. That's a huge barrier. And we're all pulled in so many different directions. So time in education is an overarching barrier to begin with. Really having the time to coordinate these things, or re-coordinate at the last minute. You find out that you had arranged something and now somebody can't make it, and you're kind of scrambling to fill in the holes. That's a huge barrier. Another issue is always getting the nurses there. I've had issues where even with new to practice, I'm needed on the unit. And I'm saying, well, you're an orientation. You're an extra person. What do you mean? So what I have done to get around that barrier is right from the beginning, in orientation, I provide the new to practice nurse, the manager, the preceptor, everybody with the entire schedule for the whole year. Not per se the orientation, but the new to practice program. And I also register these nurses for the classes. So if I have a nurse that needs to attend the curriculum, like Caring for the Oncology patient, oncologic emergencies, we offer those monthly. Right off the bat, I schedule the nurse for that date. I let them know. I let the manager know and the preceptor know. So that can avoid that barrier of a scheduling type of issue. So with that time issue. But that's been a real struggle, a big issue for me personally. And I know for other education coordinators that are colleagues of mine, they've had the same issue.
Well, that would be great that we could be a great team then.
Yeah.
You've mentioned, the whole COVID thing a few times. And another thing that I was thinking about is the learning styles. So, as an education coordinator, I'm not sure how large your orientation classes are of these new to practice nurses, but I can imagine that within that group, you probably have a lot of different learning styles sitting in that classroom with you, or, however you all do that. Some people are all hands on, some people like to listen or read. So when you are developing your orientation curriculum and how this is going to go for your new nurses, what do you do to ensure that all of them are getting the information that they need and kind of in that optimal learning environment?
I had a cohort recently that had 35 new to practice nurses. Now, granted, they weren't all oncology nurses, but they were nurses from the oncology setting. There were nurses from the emergency department, critical care areas, labor and delivery. And yes, learning styles are very different. And especially when you're talking about somebody going into the emergency department. Any nurse that's going as a new to practice into the emergency department, their focus is, I need to get skills. I need to get my hands on things. I need to be playing around with things because it's a lot of hands on, a lot of technical things. Whereas an oncology nurse, learning style is going to be a little bit differently. We're going to have to be having some conversations, discussions, case studies are really effective. So what I do is needs assessment. And a part that needs assessment, not so much for new to practice, tell me what it is that you need as far as didactic things and all that, but more about what is your need as a learner. And I look at that. How do I learn better? How do I learn best? And I have to incorporate all of that. I have to make sure I hit all of those points. Blended learning is really important. I think that anytime you're going to offer a curriculum, and it's funny with needs assessment, I find it really interesting that most nurses still say that and I've done these assessments, they still want lecture. And I'm thinking, most of the time everybody's kind of glazing over and finding it boring. How do I make lecture interesting? But they still want it that way. So if I'm going to do a presentation, I'm going to kind of flip the classroom a little bit. And especially for new to practice in an oncology, I taught these classes, and part of the meat and potatoes, like I like to call it, is the storytelling. But the new to practitioners don't have their stories yet. Now, some of them have had personal experiences with oncology and cancer, a family member, maybe themselves personally, and they've got some good knowledge there. They don't get a lot of this in orientation or in their clinical rotations. I have some new to practice nurses that have had 1 to 2 clinicals in an acute care setting, 1 to 2 in their entire nursing school program. So that can be an issue, and I need to know that. And I ask those questions. I need to know who's had what. So when we're talking about oncology curriculum, I will give some work before we meet. And this is asynchronous work that a nurse would need to go in and be something that I would assign in one of our learning management systems. And it can be just a presentation, something from Articulate that's more interactive, so that they'll do this work before they come into the class. Then we have the class, and then it makes it better because then we can have some discussion and we've got something to draw on. And then there's some questions being asked because, again, as an education coordinator, you say, does anybody have any questions? And you hear crickets. That's not what you want to hear. You really want someone to ask a question so that we can have a discussion. So giving that work ahead of time definitely helps. And making sure that I mix when we meet together, everything from a formal presentation, case studies, then I'll throw a little bit of hands-on. For oncology nurses, it's things like accessing and deaccessing ports, talking about blood transfusion, managing chemo. So we'll do a chemo spill, a mock chemo spill. They all want, mock drills around rapid response and code situations. We'll do those as well. I'll take them over to the sim lab at the dentistry school that I have access to that has some high-tech mannequins. So it's really mixing things up and not doing the same thing all the time. And that keeps our nurses engaged, and it hits all those different points of all those different learning styles.
Thanks. That was an excellent explanation and really good way to look at it. And 35 in a cohort, that's a lot.
Listen, I was no short of doing a dance in front of the classroom at some point to keep to keep things interesting, and I'm not shy about that because I will definitely do that.
Okay, let's talk a little bit about some of the resources that ONS offers for new nurse grads and the institutions that they're going to be working in. We have the Oncology Nurse Orientation Program. That's an institution-based, comprehensive overall, like oncology training program that can be used both for new grads as well as seasoned or experienced nurses, but they're new to oncology. And then there's also the Foundations of Oncology Nursing Practice, which is a course bundle that would be more specifically for individual nurses that talk about cancer and just treatment. Can you talk about these orientation programs?
I love them. I love that the Oncology Nurses Society has bundled these together because that was basically, what I was doing and really going through a learning management system or LMS system and trying to find those things myself. The Oncology Nurses Society has really taken that core curriculum and, developed these courses when we're talking about things like cancer biology, cancer basics. They're covering all those points. And really, when I looked at those courses, it really kind of fell in alignment with the curriculum that I had created. And I was really happy about that. The fact that the Oncology Nurses Society has done it means that we don't have to create it. It means that we don't have to update it, which is really an issue because anything that we create, we have to go back and make sure it's current and it's updated. And the Oncology Nurses Society has provided this curriculum. So that takes a lot of pressure off of education coordinators that we can actually utilize that curriculum that's already created and kept up to date. And it's really falling in alignment with what new to practice nurses need and nurses that are experienced nurses that are new to oncology. It's giving all that great foundational knowledge. And it's also allowing nurses to go back in there if there's anything, specialty areas or anything that they need to go back in to tap into. It's always there so that they can go in and take a look at that at any time for that independent learning for anything that comes up during their practice.
That's really good to hear. And I have to say, I think it is also wonderful that we have those resources for education coordinators like yourself, for those staff educators, when you are being pulled in so many directions and really having to figure out how to get all that information to those new nurses that you have, and especially with the shortages that are going on and things like that. So I think it is a wonderful resource that we have created and made available for folks.
Yeah, it really is. And the material is great. The slides are narrated. There's interactive things that are going on. You kind of mixed it up. The Oncology Nurses Society mixed it up. There's some videos thrown in there. So it's definitely more interesting and it'll keep people more engaged because there are different parts of the curriculum that for the nurse that just likes to sit there and maybe just read things, somebody who just likes to put it on and just listen to it, and then somebody who really likes to see some video components, and then some interactive stuff is in there as well. And especially those checkpoints. What's really important as we're developing any curriculum is give a little bit of information and do those knowledge checkpoints. They're really important. And that's going to make sure that, or make it so that anybody who's looking at the material is really kind of paying attention when you have those knowledge checkpoints.
Well, Christina, You have been a delight to talk to today, and just I can hear your passion for professional education and getting those new oncology nurses ready and competent to be able to take care of the patients that you have in your hospital. And as we kind of finish up, I just have a few questions that I like to ask in a quick fire manner, and I'm going to ask those now. And the first one is, what are common misconceptions about new grad orientation?
One of the common misconceptions that it's a cookie cutter approach. So there are nurses that are going to need a little bit more time, some that are going to need a little less time. They're coming in with something. So we need to make sure that it's not a cookie cutter approach. The other thing is we need to make sure with orientation is that we're matching up preceptor and preceptee. We use things like personality assessments. We need to make sure we're pairing and making so that the orientation is a good orientation. So just because someone has been deemed a really great preceptor in the past, the misconception is that they're going to get a new orientee and the relationship's going to be good. Sometimes it isn't. And it's okay to make that change. There's nothing personal about it, but the misconception is that it was okay in the past, that it's going to be okay this time, and that's not always the case. And the other thing about orientation with new to practice, everyone confuses orientation with the new to practice program. They're two separate animals. Orientation is going to focus on that direct care at the bedside. New to practice is about professional development, evidence-based practice. It's about camaraderie. It's about networking, developing relationships so that first year of practice before a nurse really has kind of settled in and says, hey, I really feel like I'm a nurse, takes about a good solid year. But we confuse orientation with new to practice. And that needs to be clear. Orientation is for all those skills that we get. New to practice is more about professional development, evidence-based practice, networking, retaining nurses, keeping them happy in their practice. And the way we do that is having a whole network of support from other new to practice nurses. So they're two separate things, and we just need to be clear about that.
Great. My next question is, what's something about orienting new nurses that's not often discussed, but you wish people knew more about?
I think that it's really important to make sure that an education coordinator, you need to have those weekly checkpoints. I check in with my new hires, but especially my new to practice nurses every week. That's really important. I sit down with the new to practice nurse, their preceptor, their nurse manager. And one thing that we have, we call it with new to practice, is Vegas rules. It's really important that everybody knows that it's okay that a new to practice nurse and education coordinator have these little conversations on the side, and it stays between us. It is not something that we just complain about things. It's about putting more tools in the tool belt. So that's really, really important. And just want to make sure that everybody is okay with that and clear about that, making sure that they meet with their new to practice nurses on a regular basis so that we know that we're reaching all of those points and we're having a forward moving progression. Things are getting better. They're not just kind of staying stagnant, or God forbid, are we going backward?
Excellent. What additional training or education do education coordinators need to develop orientation materials for those new grads?
In the aspect of oncology specifically, I think it's really important for someone to have an oncology background, certification. And, we need to have advanced degree nurses developing these programs, because when we're talking about adult learning theory, that's not something that we really expand upon in our undergrad program. When we get to those graduate levels and beyond, I think it's really important for anybody that's creating this so that we understand the difference between learning formative, summative types of education. Hope I'm saying those words correctly. It's definitely needed so that you have something to draw upon in your past practice so that it makes sense. It's really tough to develop an oncology orientation if you don't have an oncology background. because I know that when I stepped into my role looking at some programs, they just didn't seem to flow that way. I didn't felt like they functioned the way an oncology nurse thinks. So definitely have an oncology background. At that advanced degree, certification are key.
And what are some additional resources for staff educators, education coordinators that you would recommend?
Well, definitely the Oncology Nurses Society and their core curriculum. If you're going to develop anything, I think that that's a great blueprint for you to outline your program. Any kind of standards. I know for me, in addition to being oncology certified, I am also a CRNI. And a lot of the things that the Infusion Nurses Society has really complements the Oncology Nurses Society when we're talking about different types of infusion types of therapy and devices that we use commonly in the oncology setting. That's a really good complement. So always looking at standards of practice from the Oncology Nurses Society, Infusion Nurses Society. Also your local chapters. They're really important to tap into. Again, networking and then people that can help you and you can ask questions and bounce things off of. Other education coordinators. I even tap into the NCCN. Their guidelines are really important. And they also offer some great resources as long as you have an account with them. I also tap into, believe it or not, drug reps and device reps. But what I ask for with them is clinical liaison. I want that clinical person coming in. So that's another resource as well that I've tapped into. And again, it's just kind of to mix things up, have different people come in and perspectives so that they're not always saying, oh, it's Christina Klein again giving this presentation or talking. I think it's just a nice way, different learning styles, different perspectives and different information. So there's some of the resources that I tap into.
Well, great. Again, Christina, thank you so much for joining me today. It really has been a pleasure, and listening to how you go about orienting your new to practice nurses in oncology. And do you have any final comments for us today?
Just to say thank you for having me. I really love talking about education. I'm glad that you could pick up on my passion for it. And I think that that's key, is just you have to be passionate about education. And I love it. And I love working with new to practice nurses and nurses in general, just being part of a team and working together. So thanks for having me and allowing me to talk about that.
Thanks for joining me. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.